Welcome everybody. My name is Lisa Kronk and I am the nurse at the ALS Association, and we're delighted that you are all here today. This is just an overview of our talk, or at least my portion. That'll be for the first hour here. What Jennifer had asked is if you hold questions until the end of my portion, and then we'll save some time so that if you had questions about anything that I've said today, if you could ask them at that time, it would be greatly appreciated. Okay, so let's get started because we have a lot to cover. In the United States, ALS is more commonly referred to as Lou Gehrig's disease. Lou Gehrig was a famous New York Yankee baseball player who actually was diagnosed with ALS at the Mayo Clinic in Rochester, Minnesota. He died 2 years after his diagnosis. In other parts of the world, ALS is more commonly referred to as motor neuron disease. ALS was first described in the scientific literature in the late 1860s, and that's the first of many frustrations that patients and families will have. They say, you mean you've known about this disease for 100 or 140 years, 150 years, and you still don't know what causes it, and you don't know how to cure it, and that is true. What helps me, if we take ALS, the acronym, the words are amyotrophic lateral sclerosis. And I think the best way to understand it, if you break each word down, A in the amyotrophic refers to without, myo refers to muscle, and trophic refers to nourishment. So without muscle nourishment. And I'm not talking about the calories people take in, but it's message that goes from the brain to the muscle, and I'll talk a little bit more about that. Lateral just refers to the sides of the spinal cord where the motor neurons are located, and sclerosis is the hardening or scarring when those motor neurons die. ALS affects motor neurons in the body, and motor neurons are just nerve cells. They carry messages from the brain to the muscle, and basically they tell the muscle what to do. Involuntary muscles, and they affect the voluntary muscles. Involuntary muscles, like the heart muscle, is usually not affected by ALS.
Many years ago, our chapter began a durable medical equipment loan pool. And the reason it started was that Medicare determined that any piece of equipment in the bathroom was a luxury. And so Medicare would not pay for maybe a $150 tub transfer bench to help someone transfer in and out of the tub. But if the person fell and they broke their hip, then Medicare would pay for the hip replacement. So didn't really make a lot of sense. So the equipment loan pool began with bathroom equipment, and then since then has expanded into many different things.
I'd like to share some information about our Herbig Sing Communication and Adaptive Device Program. And it's one that was initially instrumental in terms of Kent Herbig, who's the first baseman for the Twins years ago. His father had ALS. And then Larry Singh, who was one of our board members who had ALS as well. And they saw a need to develop a program to help people in terms of their speech and using electronic communication devices. So the purpose was, just as it stated, to help people who are losing their speech because of either the bulbar form onset of ALS or because of continued progressive muscle weakness in terms of the respiratory muscles used for volume or for the muscles used to control the tongue and the lips. So I'll just talk with you a little bit about what services are there. One of them is voice banking. And voice banking is a wonderful opportunity for people to record their own voice. And that voice then can be used on speech-generated communication devices. So I don't know how many of you may have heard somebody using a device where it's sort of an electronic voice, and people have to decide, do they want a male voice or a female voice, high, low, all those things. This would allow the person to actually use their own voice. And so they would record it early while they still have good voice volume and good control. And then if they need a speech-generated device later, they can then input that into that device.
Our chapter has a number of support groups within our service area, and we do continually take a look at where the needs are in our service area for support groups, and as needed, develop new groups. Support groups, as you can imagine, offer anyone affected by ALS a place to go to receive information about the disease, ideas about how to manage symptoms, as well as ways to cope with the disease. Support groups also give people a place to share their stories as well as their feelings.
People with ALS are faced with losing abilities as their bodies change. Lisa and Linda both talked about the progression of the disease as people's bodies change and they lose abilities. There are times they need to grieve those losses, that those are significant changes in our lives. Increased dependency on other people, having to have a healthcare provider come in and assist with bathing or dressing can